my name is Kyle Karches. I am a general internist, teaching physician, and ethicist at St. Louis University, and together we can help medicine thrive. My goal with this video is to describe how I approach reproductive ethics as a Catholic healthcare ethicist and primary care physician. I'll first describe what my own practice is like as a general internist for some background. I'll then explain a framework that has been developed in the Catholic theological tradition that can help guide physicians' decisions. And I'll end by talking about some ways in which Catholic physicians today can go beyond these ethical obligations to promote the culture of life that Pope St. John Paul II called for. First, as I said before, I'm a general internist, which means that I provide primary care to adult patients, including preventive care against conditions such as heart disease and cancer, chronic disease management, and acute care services. However, unlike other primary care physicians, such as family medicine physicians, I do not provide prenatal care for pregnant women or deliver babies. In part because my specialty is a little narrower, I must admit that I've not often encountered difficult reproductive ethics decisions in my own practice. It's very common for my women patients, especially younger women, to see me as well as a specialist in obstetrics and gynecology who manages their prenatal and reproductive care, and so may have to address these difficult decisions more often. In my own practice, the most common sort of decision regarding reproductive ethics that I have to make is whether or not, and to what degree, I am able to cooperate with a patient's request or decision that, as a Catholic physician, I consider to be morally wrong. For example, what should a primary care physician do if a newly pregnant patient asks the physician to help her find an abortion provider? When confronted with this kind of decision, Catholic physicians can turn to the framework for decision-making that grew out of centuries of moral and theological reflection in our church, and that is described in the Ethical and Religious Directives for Catholic Healthcare Services, promulgated by the United States Conference of Catholic Bishops. This framework helps physicians discern when their actions too closely cooperate with an evil decision or action committed by another person, by distinguishing carefully between different kinds of participation in such an act. There is first a distinction between formal and material cooperation. Someone who intends the morally wrong act to occur thereby cooperates formally with that act and is just as guilty as the perpetrator is. For instance, if a physician provides a pregnant patient with medication to induce an abortion and explains how to use it in order to bring about that outcome, that physician formally cooperates with the abortion and is equally guilty. Material cooperation occurs when the physician does not share the evildoer's intention. In this category, there's a further distinction between immediate cooperation, in which someone provides the material that is necessary for the act to occur, and mediate cooperation, in which someone provides material unnecessary for that act. Some forms of mediate material cooperation can be morally acceptable, but there's a final distinction here between proximate cooperation, in which someone makes a contribution that leads directly to the commission of the evil act, and remote cooperation, in which one's contribution does not lead directly to the act. When there is a proportionately serious reason to do so, a physician may choose to engage in remote, mediate, material cooperation with a morally wrong act. An example might be if I were to prescribe a contraceptive medication to a patient as a medical treatment for a condition such as dysfunctional uterine bleeding. And if that patient, foreseeably, potentially, committed adultery while taking the contraceptive, I would not be morally guilty of cooperation with that evil, since I did not share my patient's intention and provided something that was not necessary for that act to occur. Although it probably would make things easier to have a simple rule to follow always, Catholic moral theology has tended to approach these questions on a case-by-case basis, recognizing the many different circumstances in which these questions arise. However, this general framework can help us think more clearly about how we might act when faced with these difficult dilemmas. Indeed, a Catholic physician is responsible for forming his or her conscience so that he or she is capable of discerning how to act in these difficult situations. And when our conscience does not allow us to go along with our patient's request, we should carefully and sensitively explain to the patient why we cannot do so, while reassuring the patient that we will continue to be there and to care for the patient. I can say that when I've had to have this kind of conversation with a patient, it's generally gone really well. The patient can respect and understand my explanation and still come to see me for other healthcare needs. Perhaps it helps in my case that I practice at a Catholic healthcare facility, so patients are not taken aback when I explain that I try to practice according to Catholic teaching. Going beyond this framework, however, I think there are some ways that we physicians can act positively to promote the overall culture of life that Pope St. John Paul II described. First, I think a lot of patients don't always feel supported by the medical system when they want to have children. Physicians are trained to ask their patients about forms of contraception and to encourage the use of them, perhaps especially if these patients have financial difficulties or other problems that could pose obstacles to childbearing. We as Catholic physicians can encourage and affirm our patients' desires to have children as good if they discuss these desires with us, and to help connect them with resources that might help them have children. Personally, one way I try to do so is to let my patients into my own life a little by sharing pictures of my own children and talking about how they're doing to normalize that. Those of us who counsel patients frequently about reproductive health care can also educate ourselves about fertility awareness methods, what in the Catholic Church is often called natural family planning. In recent years, there's been increased positive attention to these methods in non-Catholic circles, even in mainstream media such as the New York Times. And there are even apps that have been developed to help people use them. I think this trend speaks to a lot of interest among Catholics and non-Catholics alike in at least learning about these methods. Yet many medical schools provide students no education about them, so that we can't even help make these options available to patients who might want them. I think it's important for Catholic providers, at least, to learn about these methods and to offer to help our patients learn about them as well. In these and many other ways, we can help to build a culture of life that will help support all of us to act in accord with God's plan for human reproduction. Thank you for watching. Please be sure to like, subscribe, and comment with any questions you have.